treating the patient, not the symptoms. That's what more individuals are turning to when they seek out holistic and integrative healthcare. Joining us to talk more about this is Christine Shirzek, licensed acupuncturist and herbalist. Christine, welcome.
Good afternoon.
Break down for us what holistic and integrative medicine encompasses.
Holistic and integrative medicine means we treat the body, mind, and soul, the whole person, instead of just looking at one symptom and prescribing a pill for it. So we're trying to figure out what the problem is, where the problem comes from. We're trying to get down to the root cause and then treat the whole thing.
So, how do you go about doing that?
Well, when a person comes to see me for the first time, I take a lot of time. It's usually 1.5 hours. And I ask very detailed questions, not only about the person comes in for a headache. I want to know what are the eating habits, how does the person sleep, does the person have night sweats? I want to find out about the period for in women. I want to find out the energy level. I want to find out the pain level and the pain quality. I ask very, very detailed questions, and that takes a long time to give me an idea what's going on inside the body.
Can you give us an example, perhaps, of some of the symptoms that an individual may have, and then the next steps that you do take?
Yeah, for instance, someone comes in with a frontal headache. Then I would ask him, what did you eat this morning? Because a lot of those frontal headaches are stomach related. People have allergies. They are actually not aware of it. They think they're eating the right things. They're eating healthy, but they might not eat the healthy things that are suitable for their body because everyone has a different body constitution. And depending on the body constitution, you got to nourish your body in a certain manner. And over time, as we age, we also develop a lot of allergies. And people often don't put one and one together that headaches actually are related to food allergies. So I asked about their diet and also about their digestive system and the metabolism.
And then, so let's say they share with you what they've been eating, and you identify that that could be the root of their head, of this particular person's headache. Will you suggest, or what are your suggestions?
Well, and I can't just say you have to avoid this or that. It also depends on the person's budget. If they have the money right away to test them for food allergies, then I would do that. If they say, okay, I'm on a budget, I can only afford your treatments, the acupuncture and the herbs, then I would start with that. Very, very often this solves the problem, but sometimes it does not, and then I have to look deeper and actually run several tests on the people.
You mentioned acupuncture. I think most individuals associate acupuncture with needles, but there's a
Right.
lot more to it than just needles. Can you share with us what exactly does that entail, and how does the body react to acupuncture?
Well, acupuncture is actually inserting needles into the bodies. Those needles are thinner than hairs. They're very, very small in diameter. So for the most part, you won't even feel the insertion. Some points you would feel because it's more sensitive, but most parts you won't even feel it. Um, Acupuncture is a way to balance out the body. You know, in Chinese medicine, we go by yin and yang. Yin means excess, and yin means deficiency in a way that the body is not in homeostasis. So, for instance, let's go back to the headaches. Someone has a headache. Usually, that's too much yang energy. That's yang has the tendency to rise. So there's too much yang energy in the upper part of the body. So with acupuncture and acupressure and Chinese herbs, I would lower or descend that energy to bring the body back into balance.
Are all individuals candidates for acupuncture?
Uh, I would not use acupuncture on people who are afraid of needles, because that's, in my opinion, counterproductive.
Have you found that acupuncture and herbs, or the combination of both, is it effective for everyone, or are there some patients that it takes maybe several tries, or how many times do you have to treat an individual before you start seeing, I guess, an impact?
Well, that really depends on the condition. Generally, the younger the person, the faster they react. The older the person, the more chronic the situation is in terms of, first of all, the body weakens with aging, and then people often are in denial, or they don't go see their doctor, or they have never had holistic treatment. And then you end up with conditions that have persisted for decades. So that takes a long time to treat. Now, if I have someone who walks in and has a headache for 2 weeks, that's an easy fix, or I would say that's a much faster fix because the condition has not, become chronic over the course of time.
What's been your experience with first time patients?
Well, patients who come see me for the first time, it's either because they have been referred by their neighbor, by their friend, by their mother, by whoever, or they Google me because they have tried anything else. They have been with their headaches with any possible doctor, neurologists, and orthopedic doctors and chiropractors. No one could help them, so they want to try something else.
Christine, you mentioned acupuncture as well as herbs. Is it either or is it a combination of both?
It's usually a combination of both, especially with the chronic things, because most people don't have the budget to come see me. Like in China, they do acupuncture every day for like 2 weeks, then I take a break. In America, people don't do that. They don't have the time and often don't have the budget because acupuncture is, most often not paid by insurance. So they have to pay out of pocket. So if someone comes to see me once a week or sometimes twice a week, I always add the herbs if possible, if they're open to trying the herbs out and see what it does to them so that they have something at home as well.
What can you share with us about how you identify what herbs to use? Because some individuals may say, they're not going to work.
Well, Chinese herbology is very, very complex. You can order all these herbs online, but if you don't know what you're doing, you shouldn't try it even out, doing this yourself without consulting a Chinese medicine practitioner. With Chinese herbs, in Chinese medicine, we treat the qi. The qi means the vital energy. And the chi goes in different directions. It can go up, it can go down, it can go out, it can be dispersed. So, whatever I want to do with acupuncture, I apply the same treatment principle with the herbs. For instance, someone comes to see me with a common cold, they have a sore throat, and they have a headache, and they have a fever. So I want to expel the pathogens. So I would disperse this pathogenic infection by appropriate herbs. I would herbs that are accurate and help the body. For instance, get rid of the herb, get rid of the pathogen by sweating. That's one method to tackle a problem like that.
Are herbs similar to medications in terms that you may be allergic to certain ones?
Uh, I would not say allergic herbs, but there are herbs, there are side effects. Sometimes herbs can create side effects if you use them as an individual herb. As I said, you can order everything online, but if you don't know what you're doing, that you're supposed to use Chinese herbs in the formula to prevent those side effects because they can antagonize each other or counteract, or you got to know what you're doing. Then you don't have those side effects. So some people come and then they say, well, I'm feeling so much better, but now I have this. And that's the advantage with the Chinese herbs because I can modify a formula. I can add herbs to that formula. I can take something out. And that's also what I love about this medicine because everything is customized for that one patient.
How about individuals that have had, let's say, strokes or things along those lines? Can holistic measures assist them?
Oh, very well so. Not only in treatment, but also in prevention, because in Chinese medicine, we go by tongue and pulse diagnostics. And I can see actually on the tongue and also by observation and by smell and the way a person talks. And when I combine it with the history, if a person is prone to have a stroke down the road. So prevention is a huge topic in Chinese medicine, but also treatment, helping people to regain their speech or their movement when they have paralysis in the legs or in the arm. Acupuncture works great. In that case, we use scalp acupuncture. We put needles into the scalp that actually directly affect the brain, and people come back much quicker, and together with maybe rehab measurements. I always like to work together with Western medicine, so people actually come around much quicker after strokes with acupuncture and Chinese medicine and the herbs.
Do you ever collaborate or have patients that want you to collaborate with physicians that practice more traditional medicine?
Yes, the local hospital in my area, they send me people because they are, first of all, you need practitioners who are open to Chinese medicine. Um, but they send me a lot of pain patients, who come in for lower back pain, shoulder pain, neck pain, hip pain, whatever. So those are often patients that are referred to by local doctors in the area.
When it comes to traditional medicine, a lot of research is done and there are new medications and there are all these different things happening. When it comes to holistic and integrative healthcare, does it work in a similar manner where there are new studies or there are new things that they find?
Oh yeah, there's constantly new studies on the herbs and on acupuncture. I don't know any herb that hasn't been researched actually, where there's no clinical studies, either animal studies or clinical trials on humans. That's what it was 5,000 years ago when this medicine actually came into life. That's not what it is anymore. The principles are still the same, but everything is based on research now.
Christine, I want to thank you for taking the time to talk to us and sharing with us more about holistic and integrative healthcare.
It was my pleasure, Mabel.